Welcome everyone. Thank you for joining me. Our topic today is going to be gross and fine motor skill development. Just so you know, we will be videotaping this for a project for school. So, let's get started. First, let's discuss what motor skills are. Motor skills are actions involving use of all your muscles. So, the difference between fine and gross motor are gross motor involve the large movements, such as that you use with your arms, your legs, your feet, and your entire body, such as jumping, running, skipping, hopping, and all the things that involves. Fine motor are smaller actions, and they are use of your fingers, thumbs, toes, and can include as babies, lips and tongues. Fine motor actions would include picking things up with your fingers, moving your toes, or tying your shoes. Let's remember, every child is unique and all develop slightly different. The bodily change a child goes through can be a result from biological and environmental factors that can affect physical growth and development, such as the influence of one's genetics, nutrition, and cultural differences. There are many things that are involved in motor development that include the brain's ability to organize auditory and visual cues. This means a child needs to use their cognitive skills to be able to adjust their movements, such as how far a child's hands are when they catch a ball. If they have to look at the size of the ball, they have to know how far apart their hands need to be in order to catch that ball. We refer to milestone guidelines to steer us in the right direction of all areas of development, not only fine and gross motor skills, but cognitive, social, emotional development. These guidelines help you to understand and identify problems of development and what to look for. Now, physical growth and development refers to the ability to use and control your body. The body goes through a huge physical change from infancy to young adult. Physical activity is very important to promote growth and development. If you can think back to when you were young, maybe age 5, think of what you could do then and think of what you could do at 15. Huge difference. It's a big difference. As a baby, you start by moving your head, then they move their arms and legs, and that helps them explore the environment. As a baby grows, they begin to strengthen their muscles and are better able to control their body parts. Studies have suggested that physical activity in young children is linked to brain growth and development. It is thought that motor activity can help organize the brain. We notice as adults, when our brains are active, we work better. It is also true to improve mental health. I know this is true, so true for me. If I could get out and take a bike ride or take a walk, I feel so much better. I have so much more energy, and it makes me feel better. As a teacher, I can start instilling that in my students by stressing the importance of motor movement. It is my job to help children learn and develop by providing appropriate activities that will help in promoting physical development. Providing children with environments that will help them to use their bodies to explore. They are able to practice these new skills. We think about children with developmental disabilities, and these children may have motor planning issues, meaning motor planning is the ability to conceive, plan, carry out a skill, non-habitual motor act in the correct sequence from beginning to end. Excuse me. Incoming sensory stimuli must be correctly integrated in order to form the basis for appropriate coordinated responses. So think of this. When you are going out and you see your child and they're going to go kick a soccer ball. The ball's coming at them, and how do they know that their body or their foot or their leg is going to totally kick that ball? It takes the brain to know, okay, the ball's coming at me, how far away is it, and when do I kick it, and how much pressure do I use to kick it? So this all involves the body, the body and the brain. So for children with disabilities, that might be a little tougher for them because it's not working as well sometimes, and then planning problems come into effect, and it makes it more difficult for them to be able to carry out these motor movements. So, like when a child learns a new task, they usually have to learn it in steps. So if they're going to tie their shoes, they have to learn first, and they do it in steps. First, cross the laces. Once they have that perfected, you move on. Wrap the top lace under and pull tight. They have to practice this. This is something they need to practice over and over again to be able to get it. Where some kids this might come naturally, others it does not. Then they make a loop with one lace. So they practice that over and over again. They make a loop with the other lace. They cross the loops over each other. And this is a lot of practice. They need to keep practicing over and over again. Push the top loop over through the hole underneath and pull tight. This may take a long time for them to learn. Some kids may never learn it. And they might just get the Velcro shoes because it's so hard for some kids to learn. It's all that motor planning, and it takes the brain's ability to be able to carry that out. It is easy to see that when one breaks down the task into steps, there are a lot of room for error and confusion until the motor plan for the activity becomes set, or it's automatic because of how much time they practiced it. And that to the point where they don't need any cues. It can become frustrating for the child and for the parent or the teacher when there is difficulty learning tasks, like dressing or gathering books to take home. When there is a breakdown in motor planning, children can appear clumsy, unorganized, and inattentive, and not be able to complete tasks in a timely manner. Children with motor planning deficits learn through demonstration, repeating, and successful attempts. This is how they're going to learn. They need to make mistakes in order to learn. We all do. Even as adults, we make mistakes, but we learn from them. All right, so now we're going to go through just gross motor skills. There are different types of physical movement that are important to a child's development. Locomotor is movement that's from place to place. So that would include crawling, walking, jumping, running, skipping, hopping. These are all help in developing them gross motor skills. Non-locomotor movement happens while staying in one place. And physical movements include pushing, pulling, twisting, turning. These movements help with balance and coordination. So let's go through some gross motor skills. You have one on your table there. Everybody can grab theirs. So let's look at the gross motor. So gross motor includes, let's see where I put my gross motor. Everybody got theirs, right? Okay, our gross motor includes, at age 3, imitate standing on one foot. Okay, that's not too bad, you would think, but for a child that has some difficulties, that might be hard. Imitate simple bilateral movements of arms. Arms up together, arms in the front together. Climbs a jungle gym and ladders. Pedals on a tricycle. Walks up, down stairs, alternating feet, jumps in place with 2 feet together. Able to walk on tiptoes, catches using the body. So it's not just their arms, they're using their entire body to catch it. So there are achieved. And that could be decreased opportunities for social interaction, poor development of body awareness and movement planning skills, difficulties using playground equipment, difficulties or lack of confidence interacting with other children in active environments. So for many people, it's okay that they at this age. So they don't understand that other kids are watching them. So at age 4, you can stand on one foot for up to 5 seconds, kicks a ball forward, throws a ball overhand, catches a ball that has been bounced, runs around obstacles, able to walk on a line, able to hop on one foot. And the possible implications if milestones are not achieved would be lack of confidence in movement-based activities, difficulties using playground equipment, difficulties or lack of confidence interacting with other children in active environments. So at age 5, able to walk upstairs while holding an object, walks backward, toe to heel, jumps forward 10 times without falling, skips forward after demonstration, hangs from a bar for at least 5 seconds, steps forward with leg on same side as throwing arm when throwing a ball, catches a small ball using hands only. So now there's other implications if these milestones are not met, which may result in, oops, it went ahead too much. Here we go. May result in poor self-esteem, and the older a child gets, the more they're going to notice if they can't do something their peers can do. So lack of confidence in movement-based activities, difficulties participating in sporting activities, difficulty participating in sporting activities, difficulties playing with moving toys such as bikes and scooters. Then we go to 6 years old. Runs lightly on toes, able to walk on a balance beam, able to skip using a skipping rope, can cover 2 meters hopping. This demonstrates mature throwing and catching patterns, mature jumping. And there's also implications for this too. Difficulty participating in sporting activities may result in poor self-esteem when comparing self to others. Lack of confidence in movement-based activities. Now this makes it very difficult when also it comes to children that have motor planning issues. This makes it much more difficult for them to be able to carry out these things in front of their peers if their brain is not coordinating with their body. Okay, now we're going to go to fine motor skills. We've already discussed that fine motor skills involve small muscles. Hand-eye coordination is an important part of fine motor skill development, as a child uses their vision to control movements and actions, like we discussed with the gross motor. When a child is going to kick a soccer ball, we said that they just don't just go, it takes their brain to figure out where the ball is, how far it's coming, how hard they should kick it, where they should kick it to. Same thing with fine motor skills. You're using that hand-eye coordination to be able, and if that is not there, then that's a problem for the child. These skills are a significant part of development and early literacy and self-help skills. Remember, all children learn and develop at their own pace. However, there is a general pattern to follow of milestones, and an average range age, those skills should be achieved. We need to touch on those children with developmental disabilities again. These children experience frustration, poor self-esteem, leaving these children not wanting to even practice these skills, which is so important for them to be able to practice it so they can master it. As we go through some of the age groups of importance development, younger babies have little control. They start to learn their hands, their feet, their toes are attached to their bodies. Older babies can hold and shake objects. Toddlers begin to use their fingers to feed themselves and stack blocks. Preschool children begin to button and use scissors. School age start drawing and writing. And the trick for teachers is to get the children to be interested in doing these things. because some children don't like to cut. And teachers have to be creative to try to figure out a way to get them to practice these skills that are so important. And it's also important for caregivers as well as teachers to support our children, especially those children that are experiencing delays and challenges in their development. So now we're going to go through some fine motor skills that some children should be doing. Except my page, I think it's missing. So I'm going to take one of these fine motor skills. Okay, so at 3 to 4 years, children should be able to build towers of 9 small blocks, copy circles, imitate crosses, manipulates clay material such as Play-Doh. They can roll them into balls, make snakes. They use their non-dominant hand to assist and stabilize the use of objects. Snips paper using scissors. And if they're not able to do this, this can cause problems with delayed pre-writing skill development, frustration, or avoidance of pencil-based tasks, poor pencil grasp and pencil control, poor self-care skills such as eating, delayed drawing skills. So at 4 to 5 years old, cuts online continuously, copies cross, copies square, writes name, writes numbers 1 to 5, copies letters, handedness well established, dresses and undresses independently, which could be a lot for a 4-year-old, especially with buttons and snaps and all the things that could include those things that you need to be able to do at that age. And this could cause problems, difficulties holding and manipulating a pencil, difficulties learning to write name and other letters of the alphabet, dependency on caregivers for everyday activities such as dressing, frustration or avoidance of pencil-based tasks, which is really hard when a lot of things in school as they start to enter kindergarten are writing. So between 5 and 6, they should be able to cut out simple shapes, copies of triangle, colors within the lines. And here's something I do with a lot of my students is start with, because it's so hard for them, especially since I teach children with disabilities, is we start with them coloring in a large circle just to get them to stay in that line. We have the dark line around it just to get them to stay in, and then we go to smaller, and then we go to coloring into shapes. So that way they can start and learn how much they can do. If they still are having difficulty like this, I'll use a wiki stick and we'll put it around so then they have to stay in, and then we just slowly take that wiki stick off. So that way they know they have to stay in that line because they knew the wiki stick was there, but then we slowly just take that away so they can do it. We practice also with drawing squares. They have to be able to trace, or circles, because these are really hard for some of our kids. So, for 5 and 6 years, we use a three-fingered grasp on the pencil, which a lot of kids at that age are still grabbing it with a fist. Paste and glues appropriately, can draw basic pictures. And if they're not able to do this, there's difficulties learning to form letters correctly, poor handwriting, difficulties demonstrating academic ability on paper, fatigue during pencil-based tasks, frustration and or avoidance of pencil-based tasks.
Please excuse the interruption. We would like to wish Madison DeMarco a happy birthday. Feliz cumpleaños.
Sorry. Sorry, everyone. 6 to 7 years old. Forms most letters and numbers correctly. Writes consistently on the lines, which is another reason why we use this, for them to be able to draw on the lines. Demonstrates controlled muscle movement, good endurance for writing, can build Lego, connects, and other blocks independently, ties shoelaces. And if they're not able to do this, then we have difficulties getting ideas down on paper, experiencing fatigue during handwriting tasks, difficulty keeping up in class due to slow handwriting speed, poor legibility of handwriting, may impact on self-esteem self-esteem when comparing work to peers. And this is the biggest issue that we're worried about, is for them, you know, when they're with their peers. So now we're going to look at a couple studies. So the name of this one, and these are pretty brief, but they go right through exactly what's going on and what they've done. So this one's called Evidence-Based Milestones Ages as a Framework for Developmental Surveillance. Developmental surveillance is monitoring a child's development over time to promote healthy development and identify children who may have developmental problems. So this is, as I wrote up here, is a narrative review. So they just reviewed some of the literature. When a child goes for a well visit, a doctor should observe the child and note if there are any areas of concern. But this is not always enough. In this review, it suggests 75% of children with developmental difficulties were identified by using a developmental screening instrument. And compared to a rate of less than 54% by pediatric providers. So this is suggesting that the pediatricians are missing a lot of children with developmental delays. The American Academy of Pediatrics recommends that all pediatricians perform developmental surveillance at every child's well visit. It is also suggested that a screener be used when there's concerns for development. It is also extremely important to begin interventions even before a diagnosis is given if there are concerns. When there are concerns that show a 33% delay in one area or a 25% delay in two areas of development, an early intervention program should be utilized. The early intervention program is for children ages birth to 3 years. After they can be enrolled in a specialized preschool program to address these concerns. I have been a provider for early intervention for 6 years, and we use this assessment, and it's not fantastic, but it's called the ELAP. So it's the Early Learning Accomplishment Profile. And I'll pass this around. This is our tool that we use. This covers the 6 areas: gross motor, fine motor, self-help, social-emotional, cognitive, and language. So every 6 months, while they're enrolled in early intervention, they will get this assessment to see where they are. And this has a lot of the milestones in it that we had seen there, but for younger kids. But some of them are even on here in that range that are for kids that are 4 and 5. So they should be doing things even a little earlier according to this. So I'll pass this around so you can just take a look. And these are the 6 areas that we assess on for the early intervention program. And it's extremely important to get them help early on if there is an issue. All right, the next study we looked at was organized physical activity and health in preschool age. And this was another review. The purpose of the study was to investigate how organized physical activity can contribute to a preschooler's health. The method was a literature search of interventions that looked at improving health for preschool age children. The participants were from ages 3 to 8 and included 3,644 children. And there was a presence of a control group. The study lasted between 6 weeks and 8 months, depending on which children were in which program. There were different areas investigated, and that included cognitive development, psychosocial health, obesity, bone and skeletal health, cardio, metabolic health, and motor skill development. So we'll concentrate on the skill development for this. In 4 studies, they used music movement programs that were implemented. The results indicated a significant improvement demonstrating this type of movement can positively affect children's skills. also looked at a 20-week program for preschool students that involved a 20-minute structured lesson plus unstructured activities in the afternoon. They noted significant improvements for scores on the test of gross motor development. Another study that was looked at implemented 3 30-minute sessions every week over a course of 24 weeks showed positive effect on the test of gross motor development compared to those that followed a typical curriculum. One literature looked at a psychomotor education involved 233 participants aged 4 to 6. The results showed positive results for motor improvement. The conclusion of this study suggests a high level of motor skills can lead to an active lifestyle, making it easier to continue an active adulthood. Improving motor skills in the preschool may lead to a greater participation later on. This is what that study suggested. And one more study we'll look at. And that is a comparison of motor delays in young children, autism spectrum disorder, developmental delay, and developmental concern. The purpose of this study was to assess motor delays in children with ASD and compare those scores to children with developmental delays and developmental concerns. There was 56 children, 42 boys and 14 girls, and they were 21 to 41 months of age. 2 instruments were used: the Bailey Scales of Infant Development, 2nd edition, and the Peabody Development Motor Scales, 2nd edition. So the Bailey Scales of Infant Development 2 consisted of a mental scale, a motor scale, and a behavioral rating scale, and has been received by psychometric strengths and limitations. According to the manual, the motor scale assesses degree of control of the body, coordination of the large muscles, finery manipulative skills of the hands and fingers, dynamic movement, dynamic praxis, postural imitation, and then the Peabody developmental motor skills consists of 6 subscales: reflexes for children birth through 11 months, stationary, ability to sustain control of body within its gravity, center of gravity, locomotion, ability to move from one place to another, which we discussed before, object manipulation, ability to manipulate balls for children 12 months and older, grasping, ability to use hands, and visual motor integration. The ability to use visual perception skills to perform complex eye-hand coordination skills. And the results showed that there were significant impairments for children with ASD and developmental delay compared to children with developmental concerns without motor delays. So, as we discussed before, as I discussed how it's very difficult for children with a severe developmental disability to be able to overcome some of these things. So, guess what? It is activity time. It's time for you guys to get involved. I'm just going to move the video camera so we can see you moving along. All right, first thing we are going to do. Hi, everyone. Okay. Okay, are we ready? Okay, let's see. First, we're going to start with some gross motor activities. We're going to, and this is hard for some kids, to be able to walk one foot in front of the other. So we're going to see how you guys can do this. This is hard for our children, so let's see how we can do it as adults. And it's okay if you fall off. Good? Great job, Mrs. Lamb. That was great.
I don't think I can do any shoes. Take your shoes off.
Mrs. Wesneski, look at you go. Very good.
Back to my action gymnastics days.
Nice job. Wow, great job. Very good. And it wasn't easy, was it?
No.
It was hard. It was something hard to do.
Absolutely.
So, now, one of the skills for the young was to stand on one foot. So let's try to stand on one foot, even for 5 seconds, with your foot all the way up. It's not as easy as we think it is. Right? Yeah, it's not as easy. Now let's try to hop. They said 2 meters. How far is 2 meters? Let's try to hop on one foot.
Oh.
Hop.
2 meters?
Yeah. It's not, right?
It involves all the muscles.
It involves all the muscles.
All the control of the muscles.
And
And
you're
thinking about it too. Yeah.
Yeah, you have to think about what you're doing. I know. All right, so then they have another one, which is that they balanced on the one foot, then they jumped, but then they had to jump pretty far. So they stood and they jumped as far as they could, which now again, you're using all your muscles because you're using your arms, your legs, and everything. So let's just try to jump as far as we can jump. Good
That
job.
was good, Miss Business. I can't live up to her. I mean, I can't do it in my bed, just go like this.
Good, great. So those are a couple of the fine motor activities that our children need to be able to do at a young age. So now we're going to sit down and we're going to do some fine motor activities. Everybody pick a spot, and then we're going to rotate. So the thing with this is, though, because we're older and more experienced, we're going to do it with our less dominant hand.
Oh, you horrible woman. Okay, here we go.
So
Oh, man.
if you're righty, you're going to do it with your left hand. If you're left, you're going to do it with your right. Okay, Mrs. Lamb is sorting. And they're very small buttons. They're different size buttons, but we're going to just sort them by colors. Mrs. Fox is putting pegs in, very small pegs into small holes. And Mrs. Wesneski is using the tweezers to pick up bananas to feed our monkey.
You definitely have to have more focus.
You definitely have to have more focus for these activities. Absolutely. You're doing a great job.
My right hand doesn't know what to do.
It's all, that's the whole thing.
My right hand is sitting here.
No, I
like-
know.
Don't you almost?
Yes, I
yeah.
feel like it just feels odd.
Anybody would like some Lucky
Oh,
Charms?
I was kidding about the animal. Definitely.
It's harder.
It is much harder.
But this is something that we're doing because for a
And I'm
child that
focusing on going
does
left to
not,
right. You know, like
a child that does not know how to do it, or their brain doesn't know how to motor plan and how to work that, that's why we're doing it with our left hand. Because
disorganizing.
it's so different for you. It's disorganizing.
yeah, that is disorganizing.
Okay, once you're done,
Uh-oh. Wanna rotate?
you're gonna rotate.
I actually wanted to turn with the banana.
So rotate to the next activity.
Oh, lacing with your left hand.
No, but just picture a child that's never done it before,
Yeah, you're right.
and it's something they're expected to do.
Yes.
I can't even lace with my right hand, let alone my left.
These are all very, very difficult skills for our young children. And some need those steps that I went through earlier to be able to do it in one step. Master that. Next, add another step. Great job, ladies. Good. But after you did it, you're starting to get to use your left hand.
Yes. It feels
But
more
it-
comfortable.
Right, but it takes the practice.
Yeah, yeah. It's definitely.
It's definitely practice. And that's with our children. They need the practice to be able to do it.
Take a look.
Okay, let's rotate one more time.
You did shoes
I have
that
it
are
without
already bananas.
dogs and bones.
All right, so I'm lacing with my left.
You're lacing with your left.
Oh, that's
It's tricky. But it's, like we said, after you get used to doing it, because we're adults, we know, we can handle it. But some kids, they might get frustrated and upset that they can't do it. And one of their peers may be able to do it better. And then they'll get upset from that they can do it. And
They're doing it faster than me.
a couple little interruptions with the bell, but that was okay.
Wow, you did that really
That was
fast.
that was
Yeah,
really
oh my
good. Somewhere
gosh.
in there already.
You did that really
No,
fast.
all the years were in there. Because I had
She
a file.
cheated.
Detention.
You did that whole
Detention,
barrel of
Mrs. Lee.
bananas.
It's like, wow.
Great job. All right, that was really good. Thank you,
Oh,
ladies.
we're good? Okay.
So, in conclusion, gross motor are the large muscles and actions like running and jumping. Fine motor, small muscles and actions like picking things up and tying your shoes. Detection. Refer to milestone guidelines to steer you in the right direction for all areas of development. And intervention. Get the proper help for your child by a professional. An occupational therapist is for the fine motor. Physical therapy is, a PT is physical therapist for the gross motor skills. I want to thank everyone for coming. And we can, if you have any questions or anything, I do have an evaluation survey, if you don't mind filling that out. And thank you for being such a wonderful audience.